Hello, my name is Dr. Debbie Alexander. I'm coming to you from beautiful San Diego, California, from California Start. Wanted to present to you an analysis of the referrals that we received thus far. We opened our doors in August of 2019. We began taking referrals in October. We currently serve 81 families, and we do have other referrals in the works. The population we serve is the exact opposite to San Andreas. We have 35% of our people are adults. 65% of them are children, which is an unusual level of children. It's 2/3 of the individuals we serve are children. The age range, the mean age, the average is 14 for the children, 26 for adults. What's really interesting, if you look at the slide, is the mode age, which is the age which most commonly appears. It's 14 for the children, and for the adults, the 28 that we serve, the mode age is 18. So again, a very young population that we're serving. What's the reason for the referral? Alarmingly, at risk of losing placement, look at that number, 23% of the children, that's 1 in 4, could lose placement in their home or care facility. The mental health symptoms, that's a robust number, and we're happy to see that. That's showing an awareness within our culture and our communities on the co-occurring mental health symptoms that could be happening with IDD and ASD. The next line is alarming. Self-injurious behavior, 51% of the children, that's every other child, is harming himself, and it could be more. And the suicidal ideation behavior is also alarming. There's a level of acuteness that we have been surprised by in working with these under 18 children. Co-occurring mental health diagnoses, 32 to 38%, that seems pretty good for reporting anxiety. A lot of times other places have told us that that's not recognized, but I'm glad to see that they are seeing that within this population. The depressive disorders number appears to be a bit low, 11 to 19%. That could be underreporting. And then overreporting could be the disruptive disorders such as oppositional defiant, which is coming in at 13%. How much of that is actually accurate? Overreporting could be the schizophrenia spectrum disorders with 12%. In the adults, that's about every 10th person. And also, we were shocked to see that the trauma experienced with the children is only 2% and only 8% with adults. Again, we're wondering if there's an underreporting and a lack of investigation of the possible causes of some of the behaviors we're seeing with our individuals. Medical conditions, we are looking at the gastrointestinal, the neurological, the obesity, and the sleep disorders. Those numbers do seem very, very low. What are we looking at with these numbers? We're looking at circling back around with our coordinators and seeing, are they discovering new data? And if so, has that been entered into SIRS? And circling back around to make sure that we have fleshed out an accurate portrayal of the issues and struggles of the individuals that we serve. So what are we doing with this information? Other than working with our teams to more accurately reflect what's going on with our families and individuals, on a primary level, we want to work on education and training on autism. What is it? What does it look like? Trauma, how is that affecting their daily lives? Mental health symptoms and medical conditions. What is IDD? What is autism? And what is an actual and underlying medical condition that could be driving what they're suffering with? We want to facilitate new linkages. We want to strengthen what's already there in the family support network. We want to teach people how to recognize the signs for suicidal ideation, self-harm, and behavior. We want to work on educating the family system and care providers on better communication skills. On a secondary level, what's the diagnostic clarification? What is really going on here? We want to get more information on medical conditions. For example, is the data accurate? It seems to be a severe underestimation and underreporting of some diagnoses. And then we want to educate the teams and the systems on the medical conditions most commonly experienced within the ASD and IDD populations. On the tertiary level, let's pay attention to the self-injurious behaviors. Let's pay attention to the suicidal ideation behavior. So important. And then we want to provide increased family support strategies and implementation of these ideas. Thank you so much for your time. I appreciate you listening. I hope you have a great day. and goodbye from San Diego.